And there is still a surge of cases across the nation and Georgia. A record number of young patients are being admitted to the hospital. At Children's Healthcare of Atlanta, 101 COVID hospitalizations were reported on Tuesday and 118 on Wednesday. 74% of those were in children with pre-existing conditions. And with many of those schools switching to virtual and children's hospitals filling up with young patients infected with COVID, many parents and caregivers are once again, they're faced with questions about how to keep their kids safe during this latest surge. 11 Alive's Brittany Kleinpeter set out to get you answers.
I spoke with the president of the Georgia chapter of American Pediatrics, and he said it's a complicated time for families as the Omicron variant is so transmissible even among those who are vaccinated. He says he's seeing more cases than ever among his pediatric patients, and the list of questions from parents understandably continues to grow. Many are wondering whether it's safe for their kids to resume extracurriculars right now or have play dates with friends. Dr. Skornick says it's important for families to remember that any interaction with others involves a level of risk, especially when the virus is surging.
It's obviously a challenging situation. One of my first messages is that the vast majority of children, even if they catch COVID, have a mild disease. It's certainly not impossible to be hospitalized, but most kids get a mild illness. Right now, personally, I'm recommending testing if someone has symptoms. So if someone has cold, cough, fever, that's when I at least start thinking about testing.
Ahead at 5, I'll have more of your questions answered with Dr. Skornick and why he tells me he believes the surge will peak in the coming weeks.